Welcome to the DuPage Medical Group Institute of Sleep. DMG has 2 sleep centers that are conveniently located in the western suburbs in Naperville and Lombard and are accredited members of the American Academy of Sleep Medicine. The DMG Institute of Sleep is also a leader in its industry. Staff here perform more than 3,500 tests per year.
Sleep study is ordered in a variety of ways through the Department of Sleep Medicine. Whenever we see patients in consultation, certainly we'll determine what the appropriateness is of doing a sleep study. And if we think that a sleep study is appropriate, then we will do the ordering of the sleep studies. It can be a primary care physician, it could be an OBGYN who deals a lot with women's health, pediatrics. So it really, any general practitioner, any practitioner in general, a lot of times cardiologists will be involved with ordering sleep studies because there's so much data now to suggest how important sleep health is for cardiovascular health as well.
A sleep study is a very comprehensive measure of your respiratory patterns while you're sleeping, cardiac function, how much you're moving your legs or your upper arms, what are your stages of sleep. Also, we measure your brain waves, make sure there's no seizure activity, and we also measure your oxygen levels.
Due to the nature of a sleep test and how they are recorded, these tests are held in a lab specially created for this purpose. DMG's state-of-the-art sleep lab was created with your comfort in mind. Each sleep suite is made up of a private bedroom, which includes a queen-size bed, similar to a fine hotel, as well as a private bath complete with shower facilities. On the days leading up to your appointment, make sure you maintain your normal sleep schedule. Avoid caffeine or stimulants for 12 hours before your scheduled time of arrival, unless prescribed by your doctor. Refrain from napping and avoid using any hair products or body lotions. On the day of your test, make sure to arrive on time for your appointment. Unfortunately, if you are late, your study might need to be rescheduled. Please bring comfortable clothes such as gym shorts, loose lounge pants, and a t-shirt or pajamas to wear during your study, as bed clothes are required during your test. You should also bring any personal items and a change of clothing for after the study, as well as any medications, both prescription and over-the-counter, that you usually take prior to bedtime. Once you check in, you will be brought to your sleep suite. You will have time to change into your bedtime clothes and get comfortable. When it is time to start your test, your sleep technologist will apply sensors to your head near your eyes, chin, legs, chest, abdomen, earlobe, and finger. Application of these sensors is pain-free and they are easily removed with soap and water. These sensors are not restrictive, and should you need to leave the bed during your study, you are free to use the restroom as much as necessary without any problems from the wires. For a nighttime study, your sleep will be monitored until approximately 5:30 or 6 a.m. the following morning. You will be ready to leave your study by 6:30 a.m. Most sleep tests occur at night. However, exceptions can be made for special circumstances. When you experience disturbed sleep, such as pauses in breathing, snoring, and lack of sleep, your daytime activities could be interfered with, which could lead to serious health problems.
So there's many different sleep disorders. Some of the more common ones include obstructive sleep apnea, restless leg syndrome, periodic limb movement disorder, narcolepsies, nocturnal seizures, things of that nature. Obstructive sleep apnea being the most common. When we do the sleep study, there are certain sleep disorders that will absolutely be ruled in or ruled out. Sleep apnea is the main one. Sleep apnea doesn't come and go. Okay, it's not there one night and gone the next. Certainly there's factors that can make it worse. For instance, if you have a couple of pops at night and beverages and you go to sleep, certainly that can make your sleep apnea worse. If you're more tired than normal, that can make your sleep apnea worse. But it doesn't come and go. It's a plumbing problem, where the back of the throat collapses. And so we will almost always catch sleep apnea. Things like periodic limb movement disorder, people who very subtle leg jerking movements or arm jerking movements that prevents their brain from getting through the sleep stages appropriately, we can usually pick that up also. Some of the other sleep disorders that are more rare are hit or miss. You're not guaranteed to pick them up, but typically we can learn a lot about someone's quality of sleep, and we can rule out a majority of the sleep disorders just by having you spend one night in the sleep center.
Most people fall asleep easily during their test. Once you are asleep, the sleep technologist will start receiving your sleep data and will be able to collect an adequate representation of your sleep patterns. Once your exam is completed, your sleep study will be sent to one of DuPage Medical Group's board-certified sleep medicine physicians. The sleep specialist will provide results to your physician that referred you for the sleep study. You will also be notified of your results by the Sleep Institute. Sleep study appointments are conveniently available 7 days a week at both of our locations. Thank you for choosing DuPage Medical Group Institute of Sleep to perform your sleep study.